Good afternoon. This is United Medical. My name is Kemal Erkan. It's September 4th, Friday, right before Labor Day weekend. We are here to do our weekly event. Right now, I'm hoping that you can see my screen. We have a couple topics to discuss. Originally for today, we have Dr. Erkan from CRIAS, who was going to be our guest. He had some unexpected emergencies and he's not able to join us, but he's fine. So hopefully we'll see him in the next couple of weeks. Now we are going to discuss a couple different things. We are going to share these. Again, this is more to outreach to our patients, our clients. Today I'm going to give you those updates and then we will go from there. So I will be sharing my screen on and off, so then you can actually have the full engagement from my side. Now, from the what we are seeing so far is the changes that's happening in day-to-day healthcare landscape. So then we are trying to adapt and make the necessary changes as quickly as possible. Now, we are getting different feedbacks, different reactions from our clients. We want to make sure that we are listening what's coming from our patients so that we can actually make necessary changes based on that. From the United Medical side, because this is our 7th event, so I didn't actually include all the different backgrounds on United Medical. However, most of you know this by now. United Medical ACO is a accountable care organization and uniting different accountable care programs under one platform. So we have different wellness programs, medical weight loss, behavioral health, diabetes and nutrition education, admission and readmission prevention, and fall prevention. So these programs are actively managed by United Medical Central Office. And while we are going through this, we are trying to increase our outreach to our patients, and each of those programs do have their program directors, and we work on a daily basis to do our jobs. Now, one of the new items that I would like to share with you, we always share the patient satisfaction scores, and United Medical and the clients of United Medical, we have a high patient satisfaction scores. However, this time I do want to share our client satisfaction score for Q2 2020. And so far we have received 57 responses. And out of those 57, 96.5% of our clients are overall happy with our services. And there are some details in these, but I do want to share this since it's specific to the patient, but also I know that my team is listening from our side, so that I want them to also know that we are doing as good as possible for our clients, and therefore I'm assuming that our patients are happy with what we are doing. So, and then in the next several weeks, I will be bringing the patient satisfaction score up, and we'll review that because I think that's that's one of the most important measures for us. So then we want to make sure that we are doing necessary changes based on what comes from our patients. Now, one of the reasons that we wanted to start this meeting was we have done, my team is listening and they can actually correct me if I'm wrong, but we have done about 97 provider meetings since March 19th. So it's going to be almost 100 hopefully next week. Now, immediately Corona pandemic started, we started making changes. So, and as we were sharing everything and keeping our providers up to date, what we realized is that perhaps we can do more outreach to our patients and also share some of the information that we feel is useful, and then there's a different perspective of these numbers from our side. Perhaps it would be helpful for overall public. Since the Corona started, we we actually try to reach out to our local government. We work with our senators so that we can actually do better than what was expected from us, because it's a pandemic and it's not a normal situation for anyone. So, and that's why we are actually sharing these numbers now. Like seeing these three different date updates next to each other, I'm sure if you use Excel, you can put them together with the snipping, but I thought it would be easier for you to just see it on this, because it does show you the significant increase from the time that we started. Sometimes when we look at these numbers, it's not saying much by itself. However, when you look at the number overall from where we were, like for example, on April 15th, there were about 1 million confirmed cases. We are about 6.3 times higher than that number as of today. Now, total number of deaths, we are at almost 191,000, a little over 191,000. And that number also is almost 4 times higher than where we were in April. Now, of course, the recovered numbers are also increased, and percentages are better, so that's on the good side, but it's not changing the overall picture, because yes, we have 95% recovered, but that's after like 190,000 people. So, and then there will be more, unfortunately, coming with this. Now, from here, usually we go to the, because our home state is Delaware, so we go to Delaware. And on the Delaware State website, what you'll find is the current hospitalization and the new hospitalization next to each other. Now, these numbers are important, and then looking at these numbers for, like especially for these here, what the 10-day average versus what the actual day is. So now when we go to the total new positive cases, for example, you see this trend is, in a way, it's kind of scary, and I'm actually personally, I'm worried about how this trend is happening right now, because we are, this 10-day average is going up. So I will bring the actual site up, so then I can actually share this one a little bit better. Let's see. So then you can actually see the numbers. All right, so so this is now with the blue bar versus the orange bar. You know, in some cases, I think my team hears this every day almost, and then I do hear them making fun of me with the blue bar and orange bar. But it is a big, there's a big difference between the two. For example, this is like what's reported on the day is not what we are interested necessarily. We want to just see what the 10-day average is. So like this is scary initially, but then when you look at the total number, average number, it's maybe not, because it's not a real-time number. So now that's one thing, but when you go day by day, if this blue bar is increasing, then that's alarming. So we are at 102 average total, and that number 2 weeks ago, it was 59. Now, part of the reason, and I'm going to probably repeat this time to time, the reason we want this Facebook Live event, and the reason I feel like it's important for me to go out there and then communicate the problem. So we expect certain things from our federal government and the local government. However, we know how to read these numbers, and we know what these numbers represent. And I don't think we need someone to just spell this out for us to understand how important the situation is. So if in 2 weeks, your 10-day average is going from 59 to 102, you have to kind of make the decisions a little bit more carefully at the individual level, and for your families and for your loved ones. So the percentage of positive tests from the ones that are processed in the last couple of days, it was actually over 5%. Now it is down to 4.6. Now that number used to be a little bit around like 3.8, 3.9 for a long time, but it is also increasing. And then we'll probably see what will happen after this Labor Day weekend. And hopefully people do make the right decisions when they see these updates. Now, before I go to the next slide here, because sometimes in some cases you may not understand the motivation of some of my comments, and the thing is there is no motivation, there's no hidden agenda. We try to provide the most accurate and important update for you. So, and numbers, data actually speaks for itself. You don't need you don't need too much explanation on these numbers if you are looking at them very carefully. So this is United States total as of, once I refresh, it's going to be as of right now. So it gives us the total number of cases as of this time, but then you can go to yesterday's number and then see what the total is. Now, why I'm interested in this one is not necessarily for the daily numbers, but when I look at the test totals in 1 million for different states, when we sort this by highs to lows, as you can see from our home state standpoint, if the United States average is at 256,000, and if we are at 253,000, and another, and this has nothing to do with the political parties, and if I probably have to go with one, I'll be probably more on the Democrat than the Republican side, although I'm right in the probably center. If there's the right reason, I would like, this is not a politically motivated comment in a way. So when I see this, and when I look at, again, our famous Rhode Island right now, they are number one. And for almost last 22 years of my life, what I have seen Delaware being compared to Rhode Island, and they do have a Democratic governor, and they are number one, and they have 526,000 total tests, while we have only 251,000. Now that's a little over twice, two times, it's more than double, right? So now, well, because of that, we are going to give C- to our wonderful governor, because I don't think we are managing this properly. I don't think blaming the federal government is the solution, because if that was a problem, then Rhode Island would have the same problem. So I didn't want to actually add too much politics into this, because if I did actually, like, I probably need to list Chris Coons at A+. Chris Coons has done so much for our community and our organizations, and understanding the small business issues and communicating those in a timely manner for us. It was so important, and we appreciate him. But from the local government standpoint, we are going to leave John Carney with C- before Labor Day weekend. We hope that this can be in a month, he can actually increase his grade. So then we can actually, we do a lot more. So when he doesn't communicate, it's a big problem. It's a huge gap. So if we go to the hospital to manage the pandemic and then just totally dismiss primary care, not understanding what we are going through on the pediatric side, on the primary care side, it is not going to help the situation. So that's why we are going to leave him right here. Okay. Now, today I'm going to ask one of my directors, John Donnelly, who is on the line with me. And let's see if John is a little bit camera shy, but once he's on, he's good. Hi, John.
Yeah, Kemal. How are you?
Good.
I'm doing well.
John, we wanted to discuss the telemedicine. Now, in the prior meetings, you would remember we have done updates, and we told everyone that we have done so much on telemedicine with our practices, and why we have to do telemedicine. And you and your team are the drivers of implementing the telemedicine in our practices. So I have two small videos before I actually go to this if I can just play those. One is with the IQ Health and the other one is with the telemedicine. And I do want to actually have the discussion on do's and do nots on telemedicine and how we can actually do a better job from both from the practices and from the patient side. So this is our IQ Health video. I'm hoping that...
End your time, control of your health, end your time. With the IQ Health Patient Portal, you can access all your important health information anytime and anywhere from your smartphone, tablet, or desktop computer. Send and receive messages to and from your providers. View your test results. Request medication refills. Request an appointment. And update your demographic information. Download the Healthy Life app to your smartphone or tablet for convenient access to your IQ Health Patient Portal on the go today.
So IQ Health is extremely important for what we are doing with the telemedicine especially. And from here, I do want to actually take you to the telemedicine side of it, and then we'll actually have the dialogue.
United Medical Clinic is proud to announce we are offering the options of telemedicine visits for our patients. Our providers are ready to use Doxy.me to help provide the healthcare you need from the comfort of your own home. Telemedicine is a web-based application, so no app or download is necessary. Telemedicine visits can be set up by calling the provider's office or setting up an appointment through the IQ Health portal. Once the appointment is set, make sure you have a device with a webcam and a microphone ready. Devices such as laptops, computers, and phones will work perfectly fine. When the appointment arrives, your doctor will provide you with a unique custom link that you will want to enter into the web browser. Enter your name to check in, then your doctor will know you're ready to be seen. Once checked in, a button for enabling camera will pop up. Allow the device to enable the camera so you and your doctor can see each other. You will then be put in a virtual waiting room where the doctor can see you are ready for your appointment. Once the doctor is ready to see you, they will simply click on your name and your telemed visit will begin. We thank you for entrusting us with your care. Stay safe and stay healthy. Thanks for listening.
All right, so John, I want to make sure that I do bring you up properly. Okay, so let's do this first. All right, so there's a little bit delay from us, from Zoom to the Facebook Live, and then because I have my iPad, so then sometimes it distracts a little bit. But so, John, if you can just share how we actually started the telemedicine, how we approach the telemedicine, especially in the beginning of the pandemic, and where we are right now, because some of these videos are good, but some of them are outdated.
Sure. So yeah, our doctors really rely on us as healthcare continues to change to provide a platform for them to practice and see their patients. Historically, healthcare doesn't change quickly, but when this pandemic hit, I mean, the doctors at the end of the day need to be able to see their patients. So they really overnight needed us to give them a way to continue to see those patients that either had chronic conditions or emergent cases. So we first started using a program called Doxy.me that we saw the demo on, and we had great success with it. I think it's a very easy platform for the patients. Not necessarily the best on the provider side, but it doesn't involve the patient. They don't have to download any apps. They don't have to really create any accounts. They can just go to a web browser and be able to see their doctor. So our practices went from never doing telemedicine to overnight 100% telemedicine. And we're able to see probably 80 or so percent of the patients for the first month or so. What was really helpful for them is they were able to see patients throughout the day and even on the weekends and during on evenings. So it was opened up a lot of windows that they weren't used to, and especially the specialists. So our cardiologists or endocrinologists or surgeons didn't realize how beneficial it would be to transition to telemedicine, because again, they were able to, on a Saturday afternoon or a Sunday night, pick up the phone and be able to see the patients, which was really comforting for the patients, as well as much more efficient than a phone call. It's really difficult to talk to a patient over the phone and get a sense of how they're doing, but seeing them provides a really important element. So within a few weeks, again, we were up and running, and since I would say June or so, we were able to get back to 100% of the capacity that we were seeing prior to the pandemic. So, and again, this was almost entirely telemedicine. Since the beginning of this, we've seen about 100,000 appointments via telemedicine. So in just in Delaware, so that's 100,000 patients that were able to be seen over video instead of having to come into the office and potentially either spreading the virus or catching it themselves. So throughout this process, we were also working with Cerner, because we knew that Doxy.me was a good program, but it had its limitations. So Cerner developed and invested into a product of their own that we've started implementing recently in our offices that allows more of an organic connection within PowerChart, within the EHR. So the doctor can, while they're looking into the electronic medical record, they're able to see the patient and do their documentation. So it's just a much cleaner, more efficient way, as well as it gets the patient to use their patient portal, which again, is a huge push of ours in the last couple of years. And I think is really accelerated during this pandemic, that when you need a medical or you need a prescription refill, or you need to ask your doctor a question, it's much easier to send them a message through your portal. Or if you just need your lab results, instead of having to call and wait on the phone or wait for a call back, you can view all of that stuff online.
So John, so we started with telemedicine, and we kind of maybe reacted to telemedicine, like the pandemic with telemedicine. So we use all the different things as you explained. Now we are taking this to a different level. We already started with one of our practices, and as you mentioned, patient portal is the main driver for the proper telemedicine. So I wanted to kind of share with our audience like do's and don'ts of the telemedicine, because now what happens is we went through this initial time, and now we have the reality kind of hit us, right? So certain behaviors are changing. Now we keep a pretty close eye on what's happening on our practices and with our providers. We have certain standards, and just because this is no longer in person doesn't mean that it's going to be, we are not going to subsidize the quality. We won't be okay with it, with the substandards, because we want to make sure that we get to the same result. And we are almost in a slightly disadvantage when we don't have the patient in front of us, but this is the best we can do. But that means the quality, the standards for what needs to be done from the practices, from the physicians, from the provider side is definitely important. But then the issue came up as now the patients are changing their expectation and their behavior. And I find that very interesting. And I'm actually recently just, I started working on my last article on these types of changes, because we go through this in business. Now, for those who see us right now, John's office is right next to mine, but then we do most of our meetings still virtual. So then we are trying to keep everything as safe as possible. But this doesn't mean that we are going to change what our goal and what we want to accomplish from those meetings. So this is the same for the patient side of it and for the provider side of it. So now these are real stories. I have a case where the patient was calling while they were driving. So I have a patient who was at the beach. I mean, I didn't say, like, my providers are reporting back to me. So I had a patient who was at ShopRite. Would ShopRite pay us for the advertisements? So not ShopRite, maybe Acme. Acme will pay us. Now that's not okay. So I think we kind of need to, we need to get out of this crisis and then just adopt this in a good way. So we want to share this with our patients. And John, I didn't share this with you, but hopefully we are on the same page. So this, as we mentioned, the active patient portal. Now we do a lot of testing on our side, but we want also our patients to test their hardware before the telemedicine visit, talk to their MAs or schedulers. Also, the other thing is that before telemedicine, we had the issue of providers being late, but now we had the other way around. Like patients are late for their appointments because they don't remember. So prior to telemedicine, they were actually sitting in the waiting room and they had to be there for several minutes earlier, like 15 to 30 minutes in some cases. Now they don't remember that they have an appointment at 3 p.m. So for 3 p.m. they show up at 3:05. Well, there's the process that we have to go through. That's about minimum 15 minutes for office and providers to put the patient in the queue. So for patients to put a reminder for themselves is really important. And what may be needed from the patient, like some of the remote devices and medications should be available. Now, wear loose clothing. In some cases, these are visits and providers may want to examine what they need to. So you want to be available for those. I mean, if you are sitting in your office and then if you are all in a tie and jacket and all that, it's going to make it difficult. When you come to the exam room, we set you up in a certain way. So we at least want patients to be close to that. So the other thing is that on your phone, if you are calling from the phone, which we don't recommend, but if you do, or if you are from the device, turn off everything else that may slow down the internet. And check your insurance to see if there are any coverage problems. We do, from our side, we do it, but in some cases, plans are different, and it's important for patients to get that information. So far, John, do you want to add anything to this list from the do's side?
No, I think it's a good list. I mean, also, if you have issues, or know that you can ask family members for help. If you know that you may have problems with connections, or if you're unsure how to log on, don't be afraid to ask. Again, you can even ask the scheduler, because typically somebody from the office will either call you before or be the first one you talk to. So just ask questions if you have them. Don't be concerned or embarrassed if you're not sure how to use something.
Yep. And we are, even on the business side, we are still having some of those issues. Now, don'ts of it is don't use virtual background from the patient standpoint, because we want to know where you are and if you have the right privacy. So remember, from the practice side, from the physician side, we have certain responsibilities, and using the virtual background won't help. Using the cell phone is not the best way to do this. And knowing that this is going to be there for a while, and also even this pandemic is over, and I'm maybe saying this for our patients on Medicare, patients who are over 65, flu season, for you guys to leave your homes for things that can be done through telemedicine is not necessary. Therefore, I think if we kind of invest on some devices from the patient side, this is the future. This is going to be there. So you want to have good connection and good televisit with us. So the Wi-Fi is important for the speed of it. Now, again, as I mentioned, don't please call us while you are driving. That just scares the hell out of us. And then if the main default program fails, we still have FaceTime, WhatsApp, and other video channels available. So our providers may just call you on the FaceTime if the initial one fails. So now we kind of wanted to go over these. Now, John, let me ask you this. What do you see from your side in terms of like I'd say, you know, this is not going to go anywhere, just adopt, but from the business development side and from our clients, from our practices, do you think like next year, this time we won't use telemedicine?
No, we definitely will. Because a lot of patients like it, and again, the providers themselves like it. So once the patients, this is what they want to do. It's even if we wanted to go back, it would be really difficult. It makes much more sense to be able to integrate this and use it for certain appointment types. Now, of course, if you're getting a physical or for pediatrics, or there's always certain things that you'll need to. But if you have a sore throat, the idea of going into a doctor's office is going to feel really antiquated. It's going to be much easier just to be able to have a video call and allow the provider to hopefully diagnose you over the phone and avoid you having to come into the office and again either getting more sick or getting people sick.
Yeah. Now, so that just our people would understand, we all have families. My parents are. One is 79, the other one is 69, and I tell them the same thing. So when they need help, they can do the telemedicine when it's available. We are not exchanging, we are not like replacing the actual visits with less quality. So it is needed, it's necessary, and then our offices are still open. So when we are able to channel most of the visits through telemedicine, we can spread out the office visits or in-person visits so that those patients can be seen safely. And I give the same advice to my family, my parents and my siblings. Now, John, you are slightly younger than I am and you have a different setup. So like, for example, from your side with the school, now the kids, like what are they doing now? Like, how is that changing from your side with the pediatrician? I don't know if you are if you are doing the telemedicine on those side from the patients.
Yeah, we haven't had to yet. I mean, I do think for pediatrics, certain things, obviously there's a lot of vaccinations and there's a lot of appointments that they do need to see the doctor for, but it's a great tool, especially if you have your first child or so. There's a lot of unknowns if there's a lot of questions. So having telemedicine available, I wish it was a couple years back. And I think a lot of parents would benefit from it to be able to have a quick conversation or video conversation with their doctor if they have questions about their newborn or if they have questions about their child, whether they need to be seen or not.
So
for pediatrics, it's probably more of a supplement for pediatrics.
Sure. Now, the other thing that I was going to mention, other than what we do with the telemedicine, one other really important part of the outreach we have is our diabetes program. We start having twice a month sessions. Our accredited diabetes program does actually have 2 events every month. We started in August. Those, they're about 1 hour each. They are extremely important, extremely beneficial for patients. We go through, when it's like diabetes, it's not just diabetes. Usually there are other comorbidities. And I think any of our patients, they can always take advantage of those. Now, the other thing is we have more events from our weight loss program, from the bariatric program. So next Facebook Live event is on December 9th at 3 p.m. So this is going to be new. We haven't tried the 3 p.m. time yet before. So this is going to be Dr. Erkan, who's going to be the main surgeon from CREA's side, and from the American Surgery Center side. We'll be discussing the bariatric surgery and weight loss issues. And all of these different events that we are doing, our goal is to make these more accessible for the people. So if you, from the patient standpoint, what I really need you to get our messages, we already have our existing patients, and we already have so many patients, so that it's not, the goal is not like we are trying to get more patients from these events. The goal is to provide the information to you in different channels, so that we can actually be more helpful during these times. And that's pretty much where we are. Now next week, I will be, my guest will be Dr. Gary Singh. And then we do have, other than the Krias and Surgery Center with Dr. Erkan, we have our Friday event. And then the following week, actually next week, we also have our wellness webinar from our diabetes program. So I do want to actually just make sure that I shared that, so then Amy doesn't yell at me. So that's on September 9th. So I thought it was the week after, but it's just next week. So we'll be on Wednesday, we'll have two events, one with Dr. Erkan at 3 p.m. The other one is the wellness webinar at 7 p.m. And then on the 11th, we have the this regular event. And then my guest will be Dr. Gary Singh from Delaware Cardiovascular. Well, that's all we have for today. There are more stuff that we need to share with you, and then we are working on these in a different way to make sure that we don't just dump too much out there. So we'll be coming back to you with different events and different updates. John, thank you for joining me. So you were kind of like a lifesaver today, since Dr. Erkan wasn't able to join me. So it helps to have someone with me when we are presenting. And I'm hoping that everyone finds this helpful and useful. Please let us know if we can do anything differently. You have a nice weekend, and happy Labor Day weekend. All right, bye-bye.